Hi, my name is Christine Morrow, and I will be performing the physical examination on patient DM. I'm washing my hands. Hello, nice to meet you.
Nice to meet you.
I'm inspecting DM's overall skin, arms. Skin is pinkish. Its skin is intact. It's symmetrical throughout the body. And next, what we're going to do is inspect the scalp, the cranium, and the hair distribution, which is hair is evenly distributed throughout the cranium of the head. I'm going to palpate the frontal and the parietal and the temporal, the occipital. And now I'm going to ask that you wrinkle your forehead, open your eyes, open and shut. Very good. Puff your cheeks, clench your teeth, palpating temporal artery. And then can you open and shut your mouth? Move it side to side. Very good. And then I'm just checking for resistance. There's resistance. And now I'm going to palpate the frontal and the maxillary sinuses. Very good. Now we're moving on to the eyes. DM's eyes were previously tested with the Snellen chart. Right, left, both eyes corrected 20/20 vision. Right, left, both eyes uncorrected 20/40. Now we're going to test for confrontation. I'm going to ask that you hold this card right here, and I'm going to hold the card right here. And what I want you to do is, I need you to let me know when you see my finger. Say when.
When.
And switch.
When.
Very good. Then we're going to test the 6 cardinal positions of gaze. If you can just follow my finger with your eyes. Very good. Very good. Very good. Very good. Very good. Very good. Okay. Now I'm going to inspect your conjunctiva, your sclera, the corneas, and the irides up and down. Everything looks clear and symmetrical. Very good. Now I'm going to test your corneal light reflexes, and I do see glare in the right and the left eye. It's symmetrical. Now we will normally dim the light for testing light and accommodation. So I'm just dimming the light, just pretending. And what we will do is, as I'm just going to bring the light, the pupils are reacting to the eye, to the light. And then I will bring the light to the bridge of the nose. And as it's closer, the pupils will constrict. And as I pull them away, they'll dilate. Pupils are equally round and react to light and accommodation. Okay. Next is the nose. The nose is symmetrical. Okay, skin is intact. Just checked. Okay. Now we're going to test for patency. I'm going to have you take your finger and put it on that side, and I'm going to have you inhale and exhale. Excellent. And inhale and exhale. Excellent. Okay. Patency is bilaterally. There's patency in both nostrils bilaterally. We're going back to the ears because the ears were supposed to precede the nose. I'm inspecting the ears. The ears are intact. Skin is intact. Ears are symmetrical. Inspecting the auditory meatus and the pinnacle and the tragus. Is there any sensitivity here? Any tenderness? No? Okay. Any tenderness here?
No.
Okay. Previously tested the whisper test, and what you do is we would cover one ear, and then I would go on the opposite side and whisper cat, dog, mouse from 5 feet away. Patient was able to hear. Then the opposite ear we cover and whispered 1, 2, 3 from 5 feet away. Patient could hear. Next, we're going to check the mouth. I'm going to inspect the mouth, and I'm checking the buccal mucosa. Okay. The buccal mucosa, and skin seems to be intact. The teeth, can you smile? Your tongue. There are no tonsils because DM's tonsils were removed when he was 16 years old. There's no swelling in the gums. Then I'm going to ask you to say ah. Okay. Tongue is midline. Uvula rises at the midline. And we've inspected, again, lift up your tongue, inspected the palates, okay, underneath the soft and the hard palates. Very good. Now we would normally test for the gag reflex. We take the tongue blade and we put it at the top of the tongue, the back of the tongue, and the patient would gag. And that's actually testing one of the cranial nerves. So we've previously done that. Then we're going to have you stick out your tongue. Tongue is midline, and there's no tremors and no evidence of breath odor. Then we're going to take a look at the neck. The neck is symmetrical. There's no pulsations. Skin is intact. Doesn't seem to be any lumps. Okay. I'm going to palpate the lymph nodes, and there's no lumps. Doesn't seem to be any issues. Then I'm going to palpate the carotid artery bilaterally. This is also a peripheral pulse. Very good. Able to palpate. And we're going to listen for bruits with the bell of the scope. No bruits present. No bruits present. Okay. Trachea is midline. Now what we'll do is we'll test range of motion. So I'm going to have you do chin to chest, very good, and then back, good, right to left, good, good, ear to shoulder, excellent, ear to shoulder, okay, good, okay, and then lift your shoulders, that's good, scrunch your shoulders, very good, and there is resistance in all areas, okay. Then I'm going to palpate for the thyroid. Now normally the thyroid is hard to palpate. It's easier when the patient is able to swallow water. It's located below the cricoid and above the sternomastoid muscle. Okay. Then I'm going to have you turn this way, sideways. Right now, I'm going to have you maybe turn this way. Yeah. Turn this way. Okay. So right now I am inspecting the posterior thoracic. I'm going to inspect it. There doesn't seem to be any lumps or lesions or bumps. Hair is distributed evenly throughout the back. Now I'm going to palpate the areas to see if there's any tenderness. I don't feel any lesions or lumps or masses. Any tenderness?
No.
Okay, then right here we're going to palpate at the costovertebral area, which is usually behind the kidneys. Is there any tenderness?
No.
Okay. All right. Now I'm going to listen to your lungs bilaterally in 5 different levels. Okay. Inhale and exhale. Thank you. Inhale and exhale. Very good. Inhale and exhale. Inhale and exhale. Good. Inhale and exhale. Inhale and exhale. Inhale, exhale, inhale, exhale. Very good. Lung sounds are clear bilaterally with no adventitious sounds. So I'm going to have you turn this way. We're going to inspect the anterior thoracic cavity. There doesn't seem to be any lesions or any masses or any other abnormalities. We're going to just watch and for respirations. And you just relax. And I'm timing your respirations. And usually you could do it within 15 seconds and then time this at 4. We got 16 for respirations. Very good. And then now we're going to listen to the lungs interiorly. Deep breath in, deep breath out. Very good. Deep breath in, deep breath out. Good. In and out. Good. In and out. 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 One more in and out. Okay, then can you lean over? I'm gonna listen at the base of the heart, in and out. There are no murmurs present. Very good. Then we're going to look at our upper extremities. I'm going to look at your hands, have them turn over. Okay. Looking at the hands, viewing the hands, okay. Skin is intact. Nails look healthy. Beds are 160 degrees. They're contour. They're symmetrical with one another. Skin is a pinkish color. There's no edema. There's no swelling. We're going to check for capillary refill, which is less than 1 second. I'm going to palpate both of them, palpate the wrists. Okay. Skin temperature is warm, okay, and dry. And skin turgor, it goes right back to the body, so that's good. I'm going to have you turn, and I'm just going to palpate your radial pulse, your brachial pulse, and then I'm just going to feel for your epitrocular nodes. All right, so I'm going to do the other side. I'm going to do radial pulse, brachial pulse, and then epitrocular. You can just feel this way. Very good. Okay, now I'm going to ask you to stand. Okay, and have you turn this way so we can see the camera and back up just a little bit. Okay. So we're going to test range of motion for the shoulder. So I'm going to have you go flex and hyperextend. Bring it down. Okay. Internal rotation, or in the back, excuse me. Abduction, abduction. External rotation. Good. Supine, pronation. Excuse me. Supine. First is pronation. Supine, okay. Then flex and extend. Very good. And put your arms down. Then we're going to do the wrists. Okay, up and down. And then put it back up again. Flex. Very good. Put it back up again. Then we're going to this way. Okay, ulnar deviation. Spread your fingers. Make a fist. Okay. Once you've made your fist, you're going to open them up. You're going to bring your thumb to your pinky. Very good. Then we're going to test for resistance. You can put your arms down. Okay, now I'm just testing. Okay, flex and bend. Flex and bend. Okay, very good. Flex and bend. Flex and bend. Very good. Now hold both of my hands and squeeze. Excellent. That is the end of part 1.